Hello, good morning, good afternoon, good evening po sa lahat-lahat ng nagko-tune in sa ating 87th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you po for being a part of our credible online community, and to all those who have just discovered us for the very first time, welcome po at sana po masiyahan po kayo sa ating mga matututunan for today. So for today's topic, we are talking about and we'll be talking about COVID-19 medications. Marami na po tayo naririnig, mga nababasa over sa internet, sa social media, mga nakukuha po natin sa ating mga kaibigan. Pero alam po ba natin kung lahat ng ito ay epektibo or at least have undergone critical studies to determine whether any of these medications are proven safe and effective against COVID-19. Ang mapapayo po namin, wag po kayong susubok ng mga medications po without a prescription at ang approval ng inyong healthcare provider, even if you've heard na meron po itong, epektibo to kasi gumana po ito sa aking lola o sa aking tita, mga ganun po. Kasi mayroon pong mga side effects ang mga drugs po na inyong iinumin or iti-take. Meron din pong mga gamot na reserve po para po sa mga seriously ill, yung talaga pong malubha ang kalagayan at kailangan po silang matignan under a healthcare provider's care. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. If you're looking for the latest science-based and evidence-based information from the most credible experts in the field, then keep it right here. And as always, it's pleasure to be with all of you during our regular Friday lunch date. Ano po, we're always looking forward to Fridays because I get to share hosting duties with a mentor, also our adjunct research faculty at the National Telehealth Center. And again, the special envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon Raymond. Magandang hapon po sa inyong lahat. Nakakatuwa, nakikita ko yung mga pangalan nyo, no, na magkasama na naman tayo, and I hope this afternoon will be really very, very productive. I know it will be. Pag-usapan natin yung mga gamot, no, kasi although we don't want people to self-medicate, and I think alam naman natin na most of the time supportive care lang yung kailangan. Gusto din natin i-share sa inyo, no, yung impormasyon tungkol doon sa mga gamot na ginagamit sa ospital. So pagka nagiging seryoso ang isang pasyente, meron mga gamot na mga ginagamit. So aalamin natin kung paano ginagamit ang mga gamot na ito, bakit sila ginagamit, and of course they are being prescribed by the doctors and managed by the doctors. But we want to give you the latest medical and clinical updates on the treatment of COVID-19 kasi ngayon na meron ng bakuna. Siyempre, tinitingnan naman natin ngayon, paano naman natin maiiwasan talaga yung pagka nagka-COVID tapos malubha yung COVID, paano natin sisave yung buhay ng tao. So we've got great experts today. Antabayanan nyo, no, you will like our guest speakers today. But I have to say na I may have to leave the webinar a little early. But Rika Abad, who's been with us before, she's the Assistant Vice President for UP, will be sharing hosting duties with Raymond. So aalis ako ng medyo maaga ng konti. Nagpapaumanhin lang ako. So Raymond, go ahead.
Thank you, Dr. Susie. Huwag po kayo malulungkot dahil si Dr. Susie ay magbabalik next week din po. Kami pa rin po ang magkasama for our next week's webinar na very exciting, but we'll tease you a little bit dahil po towards the end we'll be mentioning kung sino po at ano ang aming topic for next week. For all of those who are joining us for the very first time, we usually put our discussion into context by putting out what we call the person on the street interview videos. It's developed po by our team from TVUP. We were able to interview and get interesting responses po from those who we asked the question po with regards to the effectivity and safety at ano po ba ang kanilang kaalaman ukol po sa mga COVID-19 medications. Please watch this.
Sa totoo lang, wala akong alam na gamot for COVID. As in, yung well-researched talaga na gamot, wala.
I think walang particular na gamot para sa COVID-19 since hindi pa naman talaga nai-invento yung kung ano ba yung magiging gamot for COVID-19.
Gamot para sa COVID-19, Yun, vitamin C. Pag vitamin C ka para yung immune system mo mas lumakas.
Nababalita dati na ivermectin daw, pero kulang sa research yun eh. Tsaka di ba pang ano yun? Pang animals, yung pang animal parasite.
Paracetamol lang ininom ko. Saka konting pahinga sa bahay. Saka pag-inom ng mga juice.
Kasi personally, I'm a survivor of COVID-19. And parang naging medication lang naman namin during that time is magparacetamol kasi sobrang taas ng lagnat, pataasin mo yung immune system mo through vitamins, pagkain ng mga healthy foods like vegetables and fruits.
Meron akong nababalitaan na bagong gamot na pwede sa COVID-19 pero hindi ko exactly alam kung ano yung gamot na yun.
Isa sa mga sinuggest sa aming gamot nun, yung Li Hua King Wen. Sa Chinese medicine siya eh. Pero nabebenta siya sa Mercury. Though nung hinanap namin siya sa Mercury, hinihingan kami ng reseta. So, kaya hindi nire-reseta siya ng doktor. Pero hindi ko alam kung ano yung background ng gamot na yun eh. So, hindi rin namin siya nagamit. Hindi rin kami nakabili. Ang ginawa na lang namin nun, since nga merong may COVID sa amin nun, nagpalakas kami ng immune system. Bale, ang mga ininom namin, more on vitamins.
Sa ngayon, sa mga nababasa ko kasi, parang pahinga lang daw eh. Palakas lang, pahinga muna sa bahay, palakas, kumain, vitamin C, doblehin daw yung dose, yung dating 500, yung 1,000.
Ako personally, ang ginagamit ko lang para sa COVID-19, para makaiwas ako sa COVID-19. Nagpa-vitamin C lang ako.
Siguro yung parang magiging gamot mo sa sarili mo para malabanan mo yung COVID-19. Siyempre, unang-una yung i-practice mo yung public health standard natin na mag-stay at home if hindi naman necessary na lumabas. Pinakamahalaga talaga, lastly, is yung magpabakuna ka. Kasi yung pagpabakuna yung magbibigay talaga sa iyo ng protection laban sa COVID-19.
Una, sana malampasan natin itong lahat. Nakakadalawang taon na tayo. Sana harapin natin to ng talagang may pagmamahal sa kapwa at sabihin ng tunay. Malampasan sana natin itong COVID-19 sa lalong madaling panahon.
Thank you very much, TVUP, no? Maganda talagang marinig yung mga mga pananaw ng pangkaraniwan tao. Tsaka sabi ko nga, pinakikinggan ko to kanina, Raymond. Sabi ko, alam mo, mga tao, alam naman nila yung supportive care na kailangan gawin sa bahay, no? Tsaka mukhang yung mga, sabihin, hindi naman tumatalo ng tao na uminom kaagad ng kung ano nung sinasabi ng kapitbahay or whatever. May mga duda sila. So that's good. I think that's a good thing. Pero I think we should all also be updated nga on pagdating sa hospital, meron bang mga gamot na binibigay? So maririnig natin yan. Maririnig natin yan mamaya. So thank you for that, TVUP. Yep, over to you, Raymond.
Thank you, TVUP, for our person on the street video. Thank you also, Dr. Susie, for that commentary. Ang next po natin will be something of a reminder po for everyone, and this is in preparation for our second anniversary of the Stop COVID Deaths webinar series. Just a very, very short announcement. Meron po tayo na tinatawag na call for photographs or kung ano man po meron po kayo that will form part of our COVID-19 Heroes Memorial. Dito po sa Heroes Memorial na ito, last year po kasi we launched the COVID-19 Heroes Memorial in order to honor and remember our global Filipino medical frontliners. So hindi lang po dito sa Pilipinas, kung saan man pong parte ng mundo, who have succumbed to COVID-19. We continue to collect photos. If you are amenable to sharing maybe brief stories about them, we will very much welcome them also. And those will be included as part of the COVID-19 Heroes Memorial Digital Album na magiging part po, ilagay po namin sa ating social media page, Stop COVID Deaths Facebook page. At yung ginagawa po namin na very, very special na audiovisual presentation. So if you have a Filipino medical frontliner na family member, malapit na kaibigan, colleague, sa Philippines man po o sa man parte ng mundo, whom you want to honor in the COVID-19 Heroes Memorial, please send a high-resolution portrait photo po of at least 300 dpi with our name, yung pong mga detalye, date of birth, death, occupation, etc. to television@up.edu.ph. Ito pong mga information na hopefully we'll be able to get before the deadline as shown on the screen. We would like to remember their ultimate sacrifice and also to honor their memory po, no? Ang ating pong mga Filipino medical frontliners, they have been recognized as the best in the world, and we need to, well, at least we feel the need to immortalize their selfless contributions po in the fight against COVID-19. Those who are joining us for the very first time, our webinar can accommodate up to a maximum of 3,000 participants. So please join us in Zoom so you can fully experience our interactive program. But it doesn't mean na yung ating mga sumusubaybay sa labas po ng Zoom, maybe in YouTube, maybe in Facebook, ay hindi na po makakasali dahil kayo pa rin po ay makakasali po sa atin. Although, syempre, iba pa rin po if you're able to fully experience yung ating online community sa Zoom. There are discussions po that are going on the Zoom chat box that are also interesting. Although you may be able to also post your questions or anything that you feel is related to the topic doon po sa comment section ng ating YouTube and Facebook po, because we are now being live streamed. And for those who are asking, certificates of attendance po will be given to those, thank you so much, to those who have at least spent po 50% of the webinar duration. So yun po yung mga nagtatanong kung sino man po yung mga nakakatanggap o hindi po nakakatanggap. We continue to also work towards having this be recognized through CPD units po, no? So working together with the Professional Regulations Commission to make sure that we're able to provide those CPD units. At the very least, we have already sent out all the webinar certificates po for the 85 webinars to date. We are still trying to complete sending out for webinar 86 yung pong mga certificates of attendance. Those who are asking, wala po kaming inilalabas na separate na evaluation poll. Yung pong medyo, for at least for the last few webinars, na medyo wonky po na evaluation poll. Yun na po ang aming pong evaluation poll. There's no separate evaluation poll, so there's really no need to reach out and ask for a copy of the evaluation poll. Although we really appreciate all of your responses po with regards to that.
Raymond, gusto ng audience natin evaluate kasi yung mga speakers, which we're really grateful that you're engaging, no? So we're trying to fix this technological glitch ba tawag doon, Raymond?
Yes po. At
Raymond,
least,
teka muna, may humihingi ng ano na ba yung Mentimeter daw hinihingi na. Yun
okay, sige, thank you po. Our Menti, especially for those who are outside of the Zoom, so you can participate sa ating fun quiz. Open your browsers, go to www.menti.com and use the code 27494423. That's 27494423 para po kayo ay makapag-participate sa ating fun quiz. For today's webinar, we'll have our standard panel discussion format. Our speaker will be presenting with Reactors presentations and talks being given also, and then followed by a Q&A session wherein we will be entertaining questions from the Zoom, from Facebook, and YouTube. Over to you, Dr. Susie.
Yeah, thank you very much, Raymond. No, I think before you're going to give the introduction to the webinar, di ba?
Yes po, opo. Okay, sige. So,
bago ka muna mag-introduce, Raymond, I just wanted to take up a little bit because I think our audience wants to know. Nasa news kasi yung bumukas na yung yung Philippines for Travelers. And I understand you've been involved in these discussions. Anong ibig sabihin nun? Pwede na, basta't nabakunahan na, pwedeng magbiyahe papuntang Pilipinas, yung mga nasa labas ng Pilipinas, ganun ba?
Yes po. So for fully vaccinated po ng mga foreign nationals, yun na po yung kanilang, at least yun po yung minimum po na requirement na sila po ay maging fully vaccinated. Foreigners po are covered by that provision via IATF Resolution 160-D as in dog.
Galing naman ni Raymond, pati naman artikulo.
So hindi lang po kasama dito yung mga minors below 12 years old kasi kung ano man po yung vaccination status ng kanilang kasama na parent or guardian, yun din po yung susundin po with regards to that. Sana po meron.
Okay. How about returning Filipinos, OFWs? Yun kasi ang maraming may tanong eh. Kasi
Yes po.
maraming kababayan na
They have been able to do that since the start of February with regards to no longer having quarantines dun po sa ating mga facilities as long as they are able to present an acceptable proof of vaccination. Meron pong tatlong iba't ibang proof of vaccinations po, whether it's yung through mutual recognition, the digital vaccination certificate, at saka yung yellow ICDV card, which is the International Certification for Vaccination po, issued by the World Health Organization in terms of the format po, no?
Pero dapat pakita natin yan sa audience, no? Kasi maraming nagtatanong tungkol dyan di ba? Parang ano ba, pero ngayon, okay, so right now, kung merong mga Pilipinong kamag-anak, mga nasa audience natin, no, na gustong bumisita sa Pilipinas, kailangan lang nila ay yung proof of vaccination.
Yes po. And at least ang kailangan po niya is at least a negative RT-PCR test taken within 48 hours before departure para from country of origin para hindi na po sila mag-quarantine po. Opo.
Okay, ngayon, Raymond, yung pagbiyahe within the country. So kunyari, gusto ko, let's say, may kamag-anak ako sa Cebu, gusto kong pumunta doon. Paano yun?
So, depende po yung sa pupuntahan nyo pong lugar, no? If you are doing inter-island or let's say domestic travel, there's a DILG advisory or issuance that does not necessarily require you to show your VaxCert PH kasi meron po tayong electronic vaccination certificate. If you are able to present your proof of vaccination via your paper na LGU card, and then also be able to upload yung requirements based on SPAS kasi meron pong ganoong
nalilito
requirement.
na ako, Raymond. Teka nga. May VaxCert. Di
Meron
ba?
pong
Kasi
VaxCert.
maraming nagsasabi, hindi sila makapasok doon sa VaxCert.
So, yung pong sa VaxCert po, if it's domestic travel, if you have VaxCert, then you're okay. If you do not have VaxCert, your paper LGU card as proof of vaccination will also still be accepted po.
Pwede din yung yellow na WHO.
Yes po. Although for domestic travel, that's not really something that people
Pero for international.
secure. Opo, yes
Okay.
po.
Tapos pero 48 hours before
For incoming travelers
you
into
have
the Philippines,
a
you have to
negative
have a negative RT-PCR. Opo.
Tapos pagpasok nila, nobody has any quarantine na.
Yes po. Mm-mm.
Sige, okay. So sorry, we got sidetracked a little bit, but I thought there were people who were asking for this. And so we'll proceed now. We'll talk about medications. Raymond, you're formally opening the webinar, so go ahead with your introductory remarks.
Thank you, Dr. Susie. So, marami po sa atin ang nagtatanong kung syempre marami na po sila narinig ng mga gamot na pwede pong gawing possible treatments for COVID-19. Ano-ano raw po sila? Do they really work with regards to being able to treat COVID-19? Marami na pong nakarinig ng antiviral drug called remdesivir that's being used to treat COVID-19 in adults and children age 12 and older. Pero kailan po ba siya pine-prescribe at kanino po ba siya pwedeng ibigay ng mga may COVID-19? Meron din pong mga gamot na bago katulad ng Paxlovid. Ito po ay kombinasyon ng dalawang klaseng medication. The first drug is nirmatrelvir, if I'm spelling that correctly po, to be able to block activity of a specific enzyme that causes the virus to replicate. The second drug in Paxlovid is ritonavir po, which is an antiviral to help slow the breakdown of the previous drug po. So, and then, ang pinaka-famous naman po na meron po tayo, especially with the issuance of an emergency use authorization, ay yung pong molnupiravir, o yung mas kilala po bilang Molnars, to be able to treat mild to moderate COVID-19 in adults. Pero, Kailan po ba yung binibigay? Paano po ba ang pagbigay? Can we really take them without the prescription or advice from a healthcare provider? So yun po yung aalamin po natin and really have, one of the top experts po to be able to talk about that for today's webinar. Okay. So, but before we do that, I think Dr. Susie, do we go ahead with our Mentimeter?
Yeah, go ahead. Go
okay.
ahead. Raymond. Let's do our fun quiz.
Okay.
And then we'll go to our speaker right away. Go ahead.
Okay, thank you, Dr. Susie. So can we have it on the screen, ang ating fun quiz po? We only have just 2 questions. So 2 questions po is in Filipino. Can we have it on the screen po? There we go. Okay, first question. Paano masasabing epektibo ang isang gamot? So meron po tayong options, nawawala ang sintomas. Number 2, gumiginhawang pakiramdam. Number 3, hindi ikamamatay ang COVID-19. Number 4, nabasa sa internet. At number 5, sabi ng kapitbahay. So yun po yung ating mga options, at least for this one. We have 123 respondents in Menti and more than 100 naman po sa ating Zoom poll. We'd like to greet those who are joining us from Tarlac State University in Tarlac City, Retuerma General Hospital in Ginobatan, Albay, Maasin Maternity and Children Hospital in Southern Leyte, Heramil Hospital in Polomolok, Southern Cotabato, and Bukidnon Provincial Medical Center in Malaybalay, Bukidnon. For our second question po natin, alin sa mga sumusunod ang mga uri ng COVID-19 medications? Antivirals, anti-inflammatory, dexamethasone, immune-based therapy such as monoclonal antibodies. So, dito po makikita po natin na most are, well, at least in Zoom po, no, most po are choosing antiviral drugs, but it's a little bit different po dito po sa ating Mentimeter. We'd also like to take this opportunity to greet those joining us from the German Embassy in Singapore, from Semarang, Indonesia, Alor Setar, Malaysia, Canto City in Vietnam, Chonin Hospital in Taipei, Taiwan, Riyadh Elm University Hospital in Saudi Arabia, Lunichi Ali University of Blida II, Algeria, the University of Fiji in Lautoka, San Jose, California, and Maastricht University in the Netherlands. Over to you, Dr. Susie.
Ang cute, Raymond. Ano, sabi ko, pag may lumilipat ba na bilog na maliit, ibig sabihin na nagbabago yung sagot. I really like this visualization. Diba may lumilipat minsan? Okay, so you know, okay, so let's go to our main speaker. So we are very privileged to have today somebody who has become a public figure. I've known him for some time, but I'll tell you why I know him. So a little bit of a personal story. My late father, who passed away in 2015, when he was sick, he needed an infectious disease specialist. No, and for our family, I come from a family of doctors. There was only one doctor we wanted, and kilala siya as a very good clinician, a specialist in infectious disease. Raymond, katulad mo, time award dito, I think maybe more than 10 years ago. And so we know of his work and we know how good he is, how diligent he is. Mukhang hindi na rin natutulog to. Tinignan ko yung PowerPoint presentation niya. Sabi ko, Sko, nag-research talaga ng gusto for you. Now, most of you know him because when he makes a post on social media, the doctors pay attention. Everybody pays attention because he's very thoughtful, very thorough. And I would say very, very committed to what he's doing. And we've been trying to get him on the webinar, but he's always been busy with the IATF. Nagpapasalamat kami na paunlakan nyo kami ngayon. And so we'd like to welcome to the webinar Dr. Edsel Maurice Salvaña. He is the director of the Institute of Molecular Biology and Biotechnology of the National Institutes of Health. Doc Edsel, welcome finally to the webinar. Kamusta ka na?
Good afternoon, Ma'am Susie. Good afternoon, Dr. Raymond. It's finally good to be here. Muntik pa nga maudlot kasi
Ako naman! Oo, naman sana. Sige. Yeah. So Edsel, please take the floor. People are waiting for your presentation. Please take the floor. Go ahead.
Okay. Thank you, ma'am. Let me just share my screen here. All right. So good afternoon, everyone.
Edsel, wala pa. Wala pa yung screen mo.
Wala pa?
Teka, antayin natin. Wala pa kami nakikita dito.
Oops.
There you go.
There we
Okay,
go.
we're
There we go.
Okay,
good.
yeah. It said it crashed. I don't know. So
Oh
you can
dear.
see it?
Okay. Yeah,
All
we
right.
can see it. Go ahead,
Okay.
please.
All right. Sige pa. So, I was asked to talk about COVID-19 medication, Epektibo ba? And as has already been stated. So, let's talk about what medications mean dito. So, unang-una, the objective here is to decrease mortality and morbidity. And really, the highest mortality is in the vulnerable population. Um, right now, we're lucky kasi we have effective vaccines. And this has decreased mortality by 90%. And so the medications, when we talk about what we're going to give for COVID, is mild to moderate na high risk of progression, yun yung ginagamot natin. Also, those with severe disease. Now, very important, not everybody needs meds. Most people who are vaccinated, about 99% of them with breakthrough infection, will recover from COVID-19 without the need for any antivirals or any immunomodulators. Kumbaga, symptomatic treatment only should be okay. So, this is kind of a busy table that I show people, and you can see that the highest risk population, yung red dyan, parang their risk of dying is the same as SARS, about 10%. So these are the 60 years old and above who are unvaccinated, and those with comorbid conditions who are unvaccinated. Now, if you vaccinate those guys, they go down to the lower tier by 90%. Nagiging parang community-acquired pneumonia na low risk na lang with a 1 to 3% mortality, which is the same level of risk as someone who is 20 to 59 years, who is unvaccinated, or somebody, that's it actually. So, kumbaga, bumababa sila by 1 tier. Now, those who are 20 to 59 years old who are vaccinated, yung risk nila goes from 1 to 3% of dying, magiging 0.1 to 0.2%, which is about the same as a flu. Ito yung parang medyo olive green dito. Which is the same as someone who is less than 20 years old who is not vaccinated. Pag vaccinate mo yung less than 20 years, it goes down to about the level of the common cold. So stepwise yung risks natin. And the ones that we really want to give treatment are the ones in red and the ones who are in green. For those who are, the ones in orange and the ones in red. The ones who are in green, olive green or low green, those people will recover even without medication. So yung target talaga natin for antivirals, for immunomodulators, are really those in the high risk and the medium risk categories. So what will I discuss? Medications with randomized controlled trial evidence of an effect on mortality and morbidity. In other words, may effect siya on the risk of dying and may effect rin siya on the risk of disease progression or how long it takes you to recover. I will not discuss symptomatic relief only meds. So I'm not gonna discuss yung mga cough and cold medications that really don't have any kind of antiviral activity. Not gonna discuss meds that are not recommended in the guidelines. I'm also not going to discuss prophylaxis. There is one prophylactic medication that has RCT data, and that's a monoclonal antibody. But because it's not available here, I'm not going to discuss that. They used to use also casirivimab and devimab, but for Omicron, it doesn't work. So I'm not going to discuss that either kasi they took it back sa US. So I'm just going to focus on the medications that will work on the viruses that we have right now. Particularly, it's mostly Omicron. So there are three big categories of COVID-19 medications. There's antivirals, which really kill the virus or prevent it from replicating. There's immunomodulators, which include steroids and some monoclonal antibodies that target the immune response. And then the last one, which I really won't discuss because we don't really have these medications, direct viral acting monoclonal antibodies. And as I mentioned, casirivimab and devimab belong to that category, but the US FDA actually already removed it because it doesn't really work on Omicron. And there is another drug na monoclonal antibody is not available here that still works on Omicron, so I'm not going to discuss that either. So this is a busy slide, and basically this is from the US NIH guidelines, which looks at people outside the hospital. And so the medications that work for this category of patients does not require hospitalization or supplemental oxygen. Apat yan. So ritonavir, boosted nirmatrelvir, which is Paxlovid, and sotrovimab, which is an antiviral monoclonal antibody that we don't have, so I'm not going to talk about that. Of course, remdesivir, which previously was only for severe disease, but now they're using it for mild to moderate disease in people at risk for progression. And then, of course, molnupiravir, which is the on the scale of 1 to 4 in terms of preference, siya yung pinakamababa because in terms of the activity, in terms of preventing hospitalization, it has the lowest level out of all these 4 drugs. And we'll talk a little bit more about that and why that level of evidence is C2A, whereas for ritonavir, it's A2A, ritonavir, nirmatrelvir, or Paxlovid, it's A2A, and for remdesivir, it's B2A. All right. Then on the other side of the spectrum, these are people who are now in the hospital. And for people who do not require supplemental oxygen, there's not really anything that you want to give because molnupiravir and Paxlovid will not really work for these patients who do not require supplemental oxygen. And for people who are hospitalized but require oxygen, in other words, ang definition na natin yan is severe, they will benefit from giving remdesivir plus dexamethasone or dexamethasone alone. So these are steroids. And then for those who require high flow oxygen, dexamethasone alone or dexamethasone plus remdesivir with baricitinib or tocilizumab. We'll go through all these medications one at a time, but I just wanted to show you the framework in which we use these medications. So these are hospitalized patients. And you can see at the very end, if you require mechanical ventilation or ECMO, nawala na yung remdesivir, but tocilizumab is still there. There's another drug, sarilumab, which I won't really talk about. So I will talk about remdesivir, molnupiravir, Paxlovid, dexamethasone, baricitinib, and tocilizumab. So let's talk about the antivirals first. So remdesivir, until recently, we only used it for severe disease, but now we also use it for mild to moderate in high-risk patients because of another clinical trial that actually showed that it worked very well for preventing disease progression. Molnupiravir is indicated for mild or moderate in high-risk patients. So these are vulnerable population, people with above 60 years old or those with significant comorbids. Paxlovid is the same way for mild to moderate and high risk. There's not enough evidence for hydroxychloroquine, lopinavir, ritonavir, azithromycin, ivermectin, favipiravir, and some other medications, convalescent plasma. And a lot of these are not really being used anymore except in the context of ongoing clinical trials. So this is kind of like an overview slide about where all these drugs are supposed to be acting. And the most important here really will be this RNA-dependent RNA polymerase, which the virus uses to replicate. And there is also a protein, there is also a protease here, which is really where Paxlovid acts, and we'll kind of zoom in on some of those areas in the subsequent slides. And you can see that this is where our meds work pretty much. So remdesivir and molnupiravir both work on the RNA-dependent RNA polymerase, whereas Paxlovid, here called PF07321332, but that turned into Paxlovid, works at the level of the protease. Now the protease, because the virus makes a very long protein chain, before that protein can work, it actually needs to be cut up into the functional pieces. And that's where proteases work. Same way that it does in HIV and hepatitis C. So if you have a protease inhibitor, the virus can't turn its long protein chain into a functional protein. So it pretty much stops viral replication. So these are where our antivirals work, either RNA-dependent RNA polymerase or as protease inhibitors. So let's start with remdesivir. This is a broad-spectrum antiviral, which is an RNA-dependent RNA polymerase inhibitor. And the way we use it is we load up with 200 milligrams IV and then 100 milligrams IV daily. In the past, we were only using it for severe, so we used to use it for 5 days, extended up to 10 days in certain cases, like people on mechanical ventilator. But very important that you start it within 10 days of the symptoms. Now, for mild to moderate, high-risk patients, vulnerable patients, we only give it for 3 days, not 5 days. And it needs to be given within 7 days of symptom onset, or it doesn't really work. Now, you have to be cautious in patients with hepatic and renal disease. So again, it works at the level of the RNA-dependent RNA polymerase, RDRP. And since we don't have that enzyme in our bodies, it doesn't really have that much toxicity for us. Oops, sorry. So one of the first trials that actually showed that remdesivir works was published in the New England Journal of Medicine, where it showed that there was a decrease in the time to recovery for patients that were given remdesivir compared to placebo. And they were more likely to have clinical improvement, but there was no difference in mortality. There was a trend towards decreased mortality, but first of all, it was not statistically significant. Just kind of missed it because the upper limit of the 95% confidence interval is 1.03. But at the same time, the trend was there. If there was an effect on mortality, it's considered small. And you can see, though, that looking at the forest plots, if you give this medication less than 10 days, then the effect is much better, and you can really see that it's beyond the it is statistically significant. And this is the publication. Oops. This is the publication that initially showed that it did decrease the overall. Sorry. This is the publication from WHO with the Solidarity trial, which actually did not show that it had any effect on mortality or even the initiation of ventilation or duration of stay. So this kind of confused the whole thing, because on one hand, you had this publication that said, "Oh, this works to decrease time to recovery," but then WHO comes up and says, "No, it doesn't work." And so there was really a lot of confusion after that. So Solidarity used a 10-day course. It had no placebo. It was open label. And actually, among the different arms of Solidarity, it was really the only one that had a trend towards favorability. They stopped the hydroxychloroquine, lopinavir, ritonavir, and interferon arms early. And it's actually continued to enroll. So just aside from those interim reports, I haven't seen the final ones yet. These are just forest plots. You can see remdesivir is towards benefit, but hydroxychloroquine is towards harm. And here, lopinavir, ritonavir is smack dab on one, so it has really no effect compared to placebo. And the interferon was towards harm, so they stopped that. So remdesivir, which is actually consistent with what they saw in the Act 1 trial, does not seem to have a large mortality benefit. Possibility is that it may have a small mortality benefit when they finish enrolling all those patients, but it's not certain. And there was a lot of heterogeneity in Solidarity, so there was a lot of debate among doctors, and Solidarity is not over. Remdesivir arm actually has continued to enroll. I haven't seen the final data yet. But the way forward was to look for better drugs, and remdesivir was being combined with other treatments at that time. So this is the new study, though, and this came out, it was first published around December of last year. And what they found was that if you give remdesivir early in patients who have mild to moderate disease at high risk for progression, again, people who are greater than 60 years old or those with comorbid conditions, this actually resulted in an 87% lower risk of hospitalization or death than placebo. This is almost equivalent to Paxlovid, which is about 88%, except that remdesivir is IV. So this kind of breathed new life into remdesivir. Kasi dati, we were really using it more for severe patients, patients on high flow nasal cannula, and then there was no clear mortality benefit. In this particular study, this was for high risk patients with mild to moderate disease at risk for progression, and it did a really good job of decreasing the risk of ending up in the hospital or death than placebo. Actually, nobody died on either the placebo um, or the treatment arms, and so it didn't really necessarily show an effect on mortality. But again, these are mild to moderate risk patients, but it showed a clear benefit in terms of preventing hospitalization. Very, very clear Kaplan-Meier curves here that show separation between remdesivir and placebo in terms of decreasing the risk of hospitalization. Now, Paxlovid, moving on, it's actually made up of two drugs, which is nirmatrelvir, which is a protease inhibitor, and ritonavir, which is a boosting agent. Ritonavir is something we've used a lot in HIV to boost protease inhibitors as well and other drugs. And so we're very familiar with it. It also has some activity against HIV. So you don't really want to use this in patients who have undiagnosed HIV. So it inhibits the protease of the virus, which basically, again, is responsible for chopping up the long protein chain that the virus makes so that it becomes functional proteins. And this is indicated for confirmed COVID-19 with mild to moderate disease with high risk of progression. And I'm sorry, this is actually wrong. It reduced the risk of hospitalization by 88%. This is for molnupiravir, so this is a typo. It reduced the risk of hospitalization by 88% compared to the control group. And it was terminated early due to the strong beneficial effect. So how do we use Paxlovid? 300 milligrams of nirmatrelvir, which is really two 150 milligram tablets with with one tablet of ritonavir, 100 milligrams. So you take 3 tablets taken together twice a day for 5 days, only again for mild to moderate in the vulnerable population. You need to start this drug within 5 days from symptom onset. The biggest problem is that ritonavir reacts with a lot of drugs, including rifampicin, colchicine, and the statins. Have to adjust it renally for severe impairment. Don't use this for HIV treatment naive patients because you may induce HIV drug resistance. Again, do not use beyond 5 days or for prophylaxis. And so what they found was, this is the correct data, hospitalization or death was 88% lower in Paxlovid compared to placebo. And the efficacy, you can see, did not cross 1. And there's no deaths in the Paxlovid arm, and there were 12 deaths in the placebo arm. And early trials really showed no effect in hospital patients. So this is not recommended for severe disease, and do not use it for longer than 5 days. Okay, moving on to molnupiravir. And this is really the first effective oral drug for COVID-19. It's a ribonucleoside, meaning it's kind of like a decoy for your RNA-dependent RNA polymerase. It thinks it's one of the building blocks of the RNA chain, but it tricks it, and so the whole chain terminates. And for confirmed COVID, again, not for people who are just suspected, have to confirm COVID-19 disease with an RT-PCR, again, for mild to moderate disease with high risk of progression. And this reduced the risk of hospitalization by 31%, which was initially reported, unfortunately, 50%. But when they redid the numbers, it was actually only 31% compared to the control group. And this was again terminated early due to strong beneficial effect. So it comes as a 200 milligram capsule. We use 800 milligrams twice a day. So 4 caps for 5 days. Again, only for mild to moderate in the vulnerable population. You need to start it within 5 days from symptom onset. The side effects, really no major issues. There is some laboratory data that shows mutagenicity. This is why they didn't really use this as a flu drug. You want to avoid it in pregnant women. But it's safe naman as long as you don't go beyond 5 days. And please don't use this for prophylaxis. Our joke is if you use it for prophylaxis, you might turn into a variant or something like that. It can be mutagenic, but use properly within the parameters of the study, it should be okay. All right, this is the data published just this year, actually. Early treatment reduced risk of hospitalization or death in at-risk unvaccinated adults with COVID-19. Oh, which brings me to the point. All these drugs, the data for these drugs is mostly in unvaccinated patients. So we're not really sure how much more it adds to vaccinated patients, but it probably does help. But the risk-benefit equation is different. We'll just keep that in mind. We'll discuss it a little bit more. This is the Kaplan-Meier curve for that for that study. Hospitalization or death through day 29 was 31% less with molnupiravir than with placebo. So it was initially advertised as 50%, that's naging 31%. Unfortunately, that's the hazard ratio, and you can see the confidence interval actually crossed 1. It was 1.01. And this is why, if you remember the NIH guidelines, the recommendation level was just a C2A as opposed to remdesivir, which is a B, and for Paxlovid, it was A. There's 1 death in the molnupiravir arm and 9 deaths in the placebo, so that's pretty good. And early trials showed no effect in hospitalized patients, and again, not recommended for those with severe disease. So shifting gears, we're done with the antivirals. Let's just talk a little bit very quickly, not as extensively as the antivirals. Dexamethasone for severe and critical disease, and also off-label use of tocilizumab or baricitinib, particularly if on oxygen or high-flow nasal oxygen. So dexamethasone, this was the earliest drug that was proven to decrease mortality. So when this came out, everyone was happy. We actually have something that we can decrease the risk of dying from. And so those who use dexamethasone resulted in lower 28-day mortality among those who were either having mechanical ventilation or oxygen, but not in those who did not need respiratory support. In other words, if you're not severe, you probably shouldn't be getting Dexa. And I think a lot of people are misusing dexamethasone this way because they only have mild to moderate. They're already starting them on steroids. Please don't do that, because as we know, steroids are a double-edged sword. It can decrease your immunity to other diseases. So the data is only strong for severe to critical COVID-19. And again, this was before vaccination. So this is really the data which showed an odds ratio of 0.64, sorry, relative risk of 0.64, and the incidence of death was really lower in the usual care group, at least for mechanical ventilation. For oxygen, it was a little less efficacious compared to those on mechanical ventilation, but still fairly significant, 0.82. And among those who were not receiving respiratory support or oxygen, it didn't really work. And in fact, the relative risk was above 1, but the interval crossed 1. So you can also use other steroids, prednisone, methylprednisolone, and hydrocortisone instead of dexamethasone. And tocilizumab, on the other hand, this was the second drug. Tocilizumab was kind of like back and forth, also kind of like remdesivir, because there were some trials that show it didn't really work, it didn't really affect mortality. And then this particular study, the recovery trial study, did show, interestingly, it did not affect progression of disease in terms of level of respiratory support, but in combination with dexamethasone, it seemed to decrease the risk of dying by a small amount. So it's kind of strange, because you're thinking, wait a minute, it didn't really prevent progression to high flow, to mechanical ventilation. But then why didn't the person die? Well, just like in medicine, there's many factors that we're looking at, but this was a clear benefit. And since it was against mortality, it is something that we should be using if available, if our patients can afford it, because there is clear benefit in terms of decreasing the risk of death. And you can see this is the trial data The rate ratio was 0.86, and it did not cross 1. And because there's a lot of patients, the p-value was kind of low, even though the upper limit of the 95% confidence interval was 0.96. So that's a decreased risk of death, actually. So that's pretty good. Patients allocated to tocilizumab were more likely to be discharged from the hospital alive. So you're about 1.22 times more likely to be alive if you got tocilizumab, at least in those patients with severe disease, including those who were receiving non-invasive respiratory support. But for those who are not receiving invasive mechanical ventilation, there wasn't really much difference in terms of, I'm sorry, among those not receiving invasive mechanical ventilation at baseline, patients allocated to tocilizumab were less likely to reach the composite endpoint of invasive mechanical ventilation. So this is still pretty good, but only if you separate those who are not doing invasive mechanical ventilation, because they put all those together. And then shifting gears to baricitinib, very similar to what tocilizumab did. There was no significant reduction in the frequency of disease progression overall, but it also decreased mortality. And again, this is the data. You can see the hazard ratio there is 0.57 with a p-value of less than 0.05, with a 38.2% relative reduction in mortality. And one additional death was prevented per 20 baricitinib treated participants. So why do medications matter? So the medications matter because even with our vaccination, the vulnerable populations will still have a residual 1% risk of death. And these medications can further decrease that risk of death by nearly 90%. Because remember, our target for endemic diseases in general is a mortality rate of less than 0.1%. And so for patients who are not part of the vulnerable population, their baseline risk unvaccinated is 1%, vaccinated it goes to 0.1%. So acceptable na yun. But for patients who are in the vulnerable population, from 10%, your residual risk after vaccination goes to 1%. So still not at 0.1%. But because we have meds, we can bring that down to 0.1% if we use the medications properly. We need more evidence, unfortunately, in vaccinated people because all these trials were done in unvaccinated people. The emergence of resistance is possible because these are RNA viruses, but we're only using them for short term, not like for HIV or using them for years. So there's already some data that some mutations confer decreased susceptibility to Paxlovid, to Molnupiravir, even to Remdesivir. And for instance, I think it was Alpha had lower, there was a predicted higher resistance towards some of these medications. But because these are short-term respiratory viruses, we don't expect to have much selection towards antiviral resistance. Having said that, it can happen. Happened with influenza for amantadine, and it's happening for oseltamivir as well. So we have to be careful. We have to use these medications properly. So again, not everybody needs treatment. The people that need treatment are those who are high risk for bad outcomes with mild to moderate disease, or those who have severe disease. Outside that, we shouldn't use it. We shouldn't use it for prophylaxis. We shouldn't use Molnupiravir or Paxlovid if the symptoms have been longer than 5 days. Or in the case of Remdesivir, for people who have mild to moderate disease, we shouldn't use it if the symptoms have been there for longer than 7 days. For severe disease, we shouldn't use Remdesivir if it's been more than 10 days from the time. Although, we do make these exceptions sometimes, especially when viral loads are very high. But very, very important in those who cannot get vaccinated for medical reasons, because this is really their chance for increases their chances of survival. But the most important effect of these medications is as another layer in terms of preventing them. So again, going back to that table that I showed you, yung pinaka-problema talaga natin are the people in the red and in the orange column. But if you use meds on these people, you can decrease the risk by one column down. So for instance, for those 60 years old and above or unvaccinated, from 10%, you can decrease it to 1 to 3%. For those comorbids who are unvaccinated, you can decrease it with meds to 1 to 3%. But you can see that for those who are vaccinated, it gets you to the level where the background mortality is down to 0.1, 0.2%, which is really what our target is for endemicity. And this is why a lot of countries are really opening up, because they look at this and say, wait a minute, okay, for the non-vulnerable vaccinated population, we're down to the level of the flu. And for those people who are vulnerable, it's down to 1%, but we have meds, so we can get it down to the level of the flu. And they're thinking, we don't lock down for the flu. We don't test everyone for the flu. Then why are we still locking down? And that's really the switch that was collectively flipped in a lot of these countries that are now saying that our pandemic's over, because you've gotten to the point where ICU rates are low, where the number of deaths that are attributable to COVID-19 has gotten down to the point where this is now manageable, close to what it is for the seasonal flu. And also, you've gotten to the point where we're seeing more and increased mortality now from other diseases, from chronic illnesses, where you had missed treatment opportunities because you locked everything down and people can't get to the clinics of the doctors so that they can get screened for cancer early or get proper management for their diabetes or for their cardiac disease or their other chronic illnesses. So the equation has completely shifted, where we had previously super deadly COVID-19, now not so deadly. And now we're thinking, okay, the lockdowns are costing a lot, and it's also having an outsized impact on the mortality from unmanaged chronic illnesses. And so we really have to move on. So in summary, safe and effective medications are available for the treatment of COVID-19. Antivirals are indicated for mild and moderate disease in the vulnerable population. They're also indicated for severe disease. We need more studies in the vaccinated population, but we don't really expect that to change much. The incremental benefit should still be the same, because these work to decrease viral replication. The meds and vaccines are essential in exiting the pandemic. And that's exactly why so many people are saying endemic, 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 because we're getting to the point where we're minimizing the societal impact of COVID in terms of how many people it's going to kill, how many people are going to end up in the ICU. As the mortality of COVID-19 nears that of the flu, and we have medications, and we have vaccines, and more medications and more vaccines are in development, including tweaked vaccines, this is something that we can already manage. It's not going to go away. It's not going to have zero deaths, but it's to the point where we can live with it as a society. So thank you very much.
Great. Thank you so much, Dr. Edsel. Excellent presentation po, no? I think we should find a way to laymanize that table on risk of dying para lang po mas maintindihan ng mga tao with regards to kasi sabihin, there really is no evidence with regards to the opening up, but it's very important to see that there's like a comparison, and especially with the availability of medications, and parami na rin po yung nababakunahan, mas maigi na po yung ating mga plano. So thank you so much, Dr. Edsel. We'll call you later po for our Q&A. Maraming salamat po. Hope you can take a break po muna. Our first reactor naman po is really an esteemed expert rin naman po on infectious diseases. Haligi rin po siya ng clinical epidemiology. We will really have the clinical epidemiology practice here in the Philippines be really propagated, if not for her. Very honored to have her in our webinar for the very first time, Dr. Mary Ann Lansing. Ma'am Mary Ann.
Good afternoon, everyone, and thank you very much, Dr. Raymond. and I'm really happy to be here with you during this webinar, your much watched Stop COVID webinars. So thank you very much, Edsel, for that really powerful and comprehensive presentation of the current armamentarium we have for COVID-19. We are in a very different place now, 2022 compared to 2020, when we were really scrambling around for drugs that we would give to our patients with COVID-19. Now, as Dr. Raymond mentioned, my background is both infectious diseases and clinical epidemiology. I'd like to spend a few moments to talk about the relevance of clinical epidemiology when we talk about evidence, right? I found it very interesting that the title for this webinar was Epektibo ba? Epektibo in English can be interpreted as effectiveness or efficacy. In clinical epidemiology, we distinguish between efficacy and effectiveness. When we talk about efficacy, mostly this would come from the evidence from clinical trials, such as the ones Dr. Salvaña presented. There are phase 1, phase 2, phase 3 clinical trials, but these are in a small set of patients. So you will notice, for example, that the evidence presented for molnupiravir, Paxlovid, even remdesivir, the more recent trials are really on small numbers, and they are on selected populations. These are some are multi-center studies and multi-country studies, but still limited. So at the end of the day, when you talk about the prevention of death or hospitalization, the numbers you are dealing with in these trials end up with maybe 10 in one group and 5 prevented in another group, or 8 in one group, 4 in another group. So there are very small numbers. That's why we always talk about 95% confidence intervals to determine whether maybe in the larger world, the effectiveness or efficacy percentage could range from a low range to a high range. Okay, so the other factors, so when we talk about efficacy, they're really mainly from very well-controlled randomized trials. And on the other hand, when you talk about effectiveness, we're talking about real-world effectiveness. I'm not sure in Tagalog or Filipino, whether there's that fine distinction between efficacy and effectiveness. But in English, there is a distinction. When we talk about effectiveness, you're talking about providing the drugs in the right situation, perhaps a larger set of patients who don't have the same characteristics as the clinical trial. Most of the trials were conducted on whites, Hispanics, a few Asians. Some trials don't even have a good representation of women, and very few have representation among children. So we really need to distinguish that and fine-tune when we apply these findings in the real world. But my main problem really in the real world, when you talk about effectiveness, is how accessible and affordable are these vaccines, even if they are highly efficacious. At the end of the day, a highly efficacious drug like Paxlovid, which is 80%, but costs more than 20,000 to provide to the patient, you will still have very few patients to prevent hospitalization or death if patients cannot afford it, or if the government cannot provide it for free. Let's turn to molnupiravir. As Dr. Salvaña said, it's not as effective as Paxlovid, but it is what? It's probably 1/4 or 1/3 lower in terms of cost. So there are really, you need to look at the balance cost versus the effectiveness and decide what you want to do with your patient. So those are some of the things that you need to think about when you talk about effectiveness in the real world. The population mix the clinical mix that you have in your own setting, and then the accessibility and affordability of these drugs. Also consider that when you talk about these drugs, they're under emergency use authorization. In other words, the Food and Drug Administration in our country and other countries are providing this on an emergency basis. There are still long ways to go in finding out what the long-term effects of these drugs are. Okay, we don't even know what the effects of these drugs are on long COVID. Okay, hopefully they have a tangential and beneficial effect on long COVID, because if you prevent severe disease and hospitalization, it may have a beneficial effect on low COVID as well, but we don't have that kind of data yet. And as Dr. Salvaña emphasized, we don't have much data on vaccinated people. Most of these trials were done in the era of the older variants. Some were done already when Delta variant was here, but very few provide evidence on Omicron. So that has to be, again, looked into when we talk about effectiveness. Okay. Now, the other thing, though, even though this is emergency use, consider that the FDA is dealing with an emergency situation with a pandemic. So there are value judgments and judgment calls that the FDA has to make, even though the data may still be short term, that we need to save lives, we need to prevent hospitalizations in this climate. But always remember, it's an emergency use authorization. We still need long-term data from these. My last point about effectiveness is just to point out that Edsel talked about the dissonance between the Solidarity trials on remdesivir and the ACT trials and the more recent Pine Tree trials. My own speculation there is because the Pine Tree trials and the ACT trials are again in very well-controlled settings where you can actually pinpoint in what kind of clinical situation remdesivir will work. However, the Solidarity trial is a large multi-country study, very different mix of patients, and therefore it was very difficult to see the overall effect of remdesivir in such a mixed population. And of course, as Edsel said, this was not a placebo-controlled trial. So another thing I'd like to add, am I over my 10 minutes now, Raymond?
Go ahead, ma'am.
Okay. The other thing, when we use these drugs, as Dr. I cannot overemphasize enough this, these drugs must be used under supervision of a licensed medical practitioner, because especially for Paxlovid, there are so many interactions and there are so many relative contraindications to its use that a doctor must really figure out that Paxlovid, although it's effective, efficacious, it may not be the right drug to use for a specific patient. In fact, in my case, when people ask me about Paxlovid, I have to refer to an app and ask them specifically what drugs they are on and go down the list to make sure that there is no interaction between Paxlovid and the drug that the patient is already taking for other various illnesses. For molnupiravir, just to underscore, it's not meant for pregnancy. There's also a warning not to use it for if women do not have effective contraception, because it is possible that while you're taking it, you're conceiving and there could be teratogenic effects. Even for men, the use among men, if you look at the literature very well, there's also a caveat there that it could affect the sperm, so that if they're asking you not to have unprotected sex within 2 or 3 months of intake of molnupiravir. Finally, I'd just like to emphasize what Dr. Salvaña mentioned about a much quoted but still very important dictum. An ounce of prevention is worth more than a pound of cure. So vaccines, which are widely available now, can prevent death and severe illness. The medicines, on the other hand, are there for those who have, slipped through the cracks and have infection and need to, where we need to prevent death or severe illness among the elderly or those with who are immunocompromised or are vulnerable. But for the general population, the big effect is through vaccination. I think that's it, Dr. Raymond. Thank you and good day.
Thank you so much, Dr. Lansang. I'd be very, very interested and maybe our audience members will also be very interested to know what that app po, what did you use for determining drug-drug interactions, especially for Paxlovid. But thank you po. We learned a lot in your talk and really the importance of really weighing the evidence with regards to all of these available medications. Thank you so much, Ma'am Mary Ann. And for our final po na reactor for today, hindi na po siya kaila sa inyo. I think this will be her third time that she will be one of our speakers for our webinar. All the way from Tolosa, Leyte, the mayor herself po, Dr. Maria Ofelia Alcantara. Mayor Ofel? We're just waiting for Mayor Ofel po to ano.
Hello, thank you, Raymond.
Thank you so much, Mayor. Opo.
Okay, thank you. And again, congratulations. Ang haba-haba na at saka yung inyong sa akin, continuous learning for all of us, especially sa local government. And thank you, Doc Edsel, that sa iyong sharing. Marami akong napulot and especially for us sa local government na kino-context itong lahat ng information, paano natin magagamit at more beneficial. So may mga decision making that we need to make at the local government unit. Of course, yung sharing na yung evidence-based at mga kailangan pa natin ni ang aking idol, Dr. Lansang, napaka-importante din sa amin yan kasi at the end of the game is ano yung sound na at evidence-based na kailangan natin for decision making at the local government. And I'm really happy din, Raymond, na ako yung last kasi lahat itong mga policies, lahat itong guidelines and informations ay napaka-importante sa local government kasi ang local government, whether we like it or else, kami talaga ang nasa amin yung mga pasyente, yung clients at kami yung first line of providers dito sa local government. Okay, so allow me to share my slides. I-focus ko yung discussion, hindi na doon sa efficacy and effectiveness, but how can we access these drugs and medicines na sinasabing effective, available, at mayroon naman endorsement ang ating authority. Sa akin ay access and availability. So kaming as panel, local government na thank you na again ako ang naging panelist uli with this very important session with Dr. Edsel and Dr. Lansang. And I will start with right now, ito may protocol at policy for managing COVID including drugs and medicine. Available ang treatment, may guidelines na sabi ng department and very important coordination with technical authority, and that's the provincial health office, and the Department of Health, and of course yung aming referral hospital, the EVRMC. And importante yan, kami yung administrative authority gagawin namin, but we need the technical authority from this especially about efficacy and the use of this medicine. And for us naman, gusto ko rin sabihin na mayroon kaming decision-making process at policy process. We have a local health board by local code. We are our juridical body to discuss these drugs and medicine that needs to be available at the local government unit. Challenges naman, importante sa atin malampasan kasi kahit anong mangyari, one way or another, may expose ka talaga sa COVID, especially kung marami na yung cases. So yung atin, kami sa local government, is to make sure ma-reduce ang risk at saka severity ng COVID-19. Sabi ni Mary Ann is prevention pa rin and still vaccination and of course minimum public health standard. And then, kung sinasabi natin makaka-reduce ng risk and severity, paano naman ng local government makaka-access nitong medicines? And kung ma-maintain yung asymptomatic or kung ba exposed naging positive or mild, para maging ma-continue yung economic, this is very important for local government unit na i-maintain or i-sustain yung progress or yung economic viability at the local level. Very importante. And the most challenge, fake news. Sabi niya, maganda daw itong gamot. Inumin mo to. Sabi ng Facebook, ganito ito. And this is really more sa harm rather than beneficial. So very challenging talaga yan. Ano ba talaga, ano ang sasabi? And I'm really with that discussion dito sa ating Stop COVID Deaths that we have this continuous learning. And ano yung take off natin as presented kanina, may mga policies. So like itong yung DOH, yung Medicine Access Program, meron silang recommendation to certain medicine use in the treatment of COVID-19 under a maximum retail price. Sabi nga ni Mary Ann, available nga pero kung 20,000 naman yan, mahihirapan din especially yung marginalized sector. May DOH administrative issuance on the use of COVID-19 medicines and yung utilization or authorization for compassionate drug use. And sa local government naman, very important yung following yung rules of procurement. And with COVID, negotiated procurement is allowed. So pwede naman kaming bumili kung available na ito sa market. Okay. So ano yung consideration in the ground? Apat ang aking highlight. First is the access of information. Drugs and medicine use as presented kanina. Timing to give kasi para mas maganda ang effect. Tama yung maging mas effective siya. Second is ano yung proseso to get, especially kasi these are considered compassionate drug at meron yung iba, sabi nga, emergency authorized yung pag-available nito. So next is the procurement. Sabi ko nga is a negotiated procurement, yung patient information na kami sa ang local government provides the information to our constituents. But dami kasing information na kailangan ma-filter at ang tama at extreme, lalo na yung parang hindi mo akalain, hindi mo naniniwala pala yung may naniniwala sa ganitong hindi naman siyang wala namang evidence or sound na gawin yung intervention na yun. Okay. The second is the access itself to the medicine. Right now, itong dito sa Region A, available ito sa DOH Hospital. Hindi pa ako nakaano sa FRMC but yung sabi ng DOH, these are available. And kami sa local government ay can access these medicines. Hindi naman pa kami makakabili kasi hindi kami authorized yung para magbigay ng itong compassionate drugs or emergency use. As I mentioned, available sa aming hospital and of course in coordination with DOH sa amin like CHD 8. And importante ito is the patient list na ibibigay of course importante, sino ang bibigyan natin? So that na kasi ang ating target is to reduce mortality and risk and morbidity nitong mga COVID patients. So kailangan din siya ng consent at saka pirma pa nga ng pasyente na, of course, pirma, part of the consent, na part of the patient list para ma-access itong drugs and itong medicine for COVID-19. And again, ang issue of affordability, ito rin ang masabi natin sa access of the medicine, especially for the marginalized sector. Kung i-open ito sa market, kung talagang nandun ito sa market, is paano naman yung marginalized at vulnerable and poor sector kasi affordability, napakamahal, no? Nitong mga gamot na ito, and especially hindi siya mostly one time, may dosage din tayong susundan, and it's really a question on how we can finance yung medicines. Okay, yung third is again the cost and the budget. Kami sa local government, we are mandated, actually sa Tolosa, na-shift namin ang aming budget to COVID mostly. Kasi dito naman ang focus, dito ang interventions, kasi kailangan wag ma-COVID para ma-economically mapatuloy ang progress at yung ma-reduce ng risk ng patient plus ng municipality, no? So we can allocate naman, especially if it's medically necessary, no? And libre naman siya sa ngayon from authorized or to dispense and use compassionate drugs. So mayroon lang proseso na susundan natin para makarating tayo like sa Region 8 sa Eastern Visayas Medical Center with the Department of Health. The fourth is the health monitoring and reporting. As kanina inaano ko yung sinasabi ni Dr. Lansang, yung the research base, and I think very yung mas ma-report yung after the use of the drug, the effects of the medicine, and makatulong sa study and research or contributes to the study and research, especially yung maraming sector na kailangan ma-involve para talaga totally. And ang virus, di ba, ngayon Omicron na, baka may future mapalayo, no? But this still can happen, yung may migrants na new na pwedeng dumating. So ano na ngayon ang magiging effect nitong medicine. So very crucial sa amin, sa local government, is to report itong umiinom ng gamot, ano yung effect doon sa umiinom ng gamot, at maging, kami din, magamit namin yan for, although siyempre wala yan sa confidence level of 95% para gawa kami ng yung recommendation at magamit namin sa our policy. We will still depend on the bigger research na kakailanganin. So kami contributes by reporting itong drugs and medicine na ginamit namin for COVID management. Okay, so experiences namin sa field. Yung importante ma-reach yung client. Sabi ko nga, ang local government at the end, whether you're like it or else, kami yung in charge to ensure the health of our constituents. So for the 20,000 population in Tolosa and 6,000 household in 15 barangays, kami yon ang in charge, and especially the chief executive make sure that yung constituent are healthy, yung policy natin are sound, and like itong use of drugs and medicine for COVID. And with partnership with the barangay LGU. Take note, munisipyo to the clients, dadaan ka pa rin sa barangay. Mas malapit ang barangay. But most of the technology or yung management is nasa munisipyo. So we need to have, para ma-identify natin sino yung bibigyan natin ng gamot, sino itong mga cases. Very crucial yung second bullet. Sinong bibigyan? Asymptomatic pero high risk, may comorbidity, bibigyan ba natin? Considering yung cost din, and kung maka-access din tayo doon sa ABMC o sa DOH, sabi nga mild to moderate, asymptomatic with high risk. Yung third, yung again, yung challenging access, availability of use, meds kasi available nga lang siya sa Tacloban, that's 25 kilometers away from Tolosa. And ito na-experience talaga namin na nagkaubusan ng oxygen. Mayroong pambili pero hindi available yung goods at saka products. Kaya mahirap din at awren. So very important yung planning na ensure na lahat ng kakailanganin natin for COVID management ay available at may buffer tayo. So ang ating dito sa drugs and medicine is to ensure the rational drug use. Hindi yung sabi-sabi ng kapitbahay ko, sabi ng TV, sabi ng radyo, sabi ng Facebook, but I mean, make sure na ito ay sound-based para we will give these drugs and medicine. And para malaman kung sino binabantayan talaga proactive that we monitor, and kudos to our barangay health workers, to the DOH, HRH, deployed nurse and midwife and vaccinators, and of course with births natin sa barangay at Team RHU, na sila yung daily nire-report yung may simptoma at makikita natin kung sino yung may mild, moderate, or high risk para bigyan natin itong mga gamot na pwedeng ibigay. Pero right now, hindi ang Tolosa is hindi siya kumbaga ibigay agad. So we're still with home remedies and increasing yung both, and of course prevention pa rin, pabakuna. So ang effort naman is really on the vaccination. And of course, the health monitoring and daily reporting, talagang pagod na itong mga health worker natin on the grounds. But COVID ay pa rin at may risk pa rin sa ating constituents. So yung sa Tolosa, we have per barangay health worker, may 20 households na tinitingnan niya daily and then nire-report. Lalo na ngayon, na-open na yung wala nang quarantine. Ang daming dumarating sa Tolosa, and this holds true to the other local government, mga LSIs, returning residents, na kailangan din natin bantayan. In this past 2 weeks, meron kaming 100% LSI positive. Meron kaming 50%, depende. So if you look at average, mga 50 to 60% ng mga LSI o returning residents, dito galing yung aming mga positive at nagkakaroon ng close contacts. Kaya very important na minomonitor ito ng ating mga health workers. And in our experience sa grounds, aside sa vaccination, yung home remedies work. So ito yung steam inhalation, warm water therapy, warm saline gargle at saka mouthwash, and of course medicine to boost your resistance and your immune system. At para ma-reduce yung risk, morbidity, and mortality. Again, reminder for medicine is ensure the rational drug use. Ito, share ko lang kasi with this learning na I look forward nitong ating Stop COVID Debt learning sessions, sharing natin kasi good, better, best, never let it rest. Till your good is better and your better is best. And ang aking pa rin is while medicine is available, sa atin pa rin ay magpabakuna and mag-practice ng minimum public health standard. Gawing habit ito and maging part ng ating character. This is the only way. And then report at once yung may symptoms, isolate agad all with symptoms, and consult your health providers. May mga naka-assign sa mga families natin and household na health workers para magbantay, mag-report at mag-consult. So team, maraming salamat. Thank you for this opportunity na ang Tolosa nakapag-share again. Ano ba sa laylayan ang nangyayari in terms of use of medicine. Thank you very much and I salute your group. Congratulations once again and mabuhay.
Maraming salamat po, Mayora, ang aming Yorma. Ofel, thank you so much for that, really giving the perspective po from the local government. We'll move on very quickly to our Q&A. So we'll like to ask Dr. Salvaña and Dr. Lansang to open up their cameras But before we start addressing the questions, we'll have a very, very quick public service announcement or PSA po, ang ating commercial right after all of the presentations. Take it away, TVUP.
Happy birthday, mahal!
Thank you, mahal.
Happy birthday,
Happy
Mommy!
birthday,
Hi, Dad! Hi, Mom!
Birthday!
Thank you, mga anak. Thank you.
Love you, Mommy!
Miss na namin kayo.
I miss you, both of you. I miss you.
Miss ko na kayong lahat.
Mommy, sana magkakasama na tayo muli.
Miss ka na namin, Mommy. Happy birthday, Mommy.
Miss and love you,
Mommy.
What did you wish for, Lola?
My wish, magpapabakuna na ako.
Ako din!
Dahil mahal ko kayo, magpapabakuna ako.
Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines, headed by our UP Vice President for Public Affairs, Dr. Elena Pernia, and funded by the DOST-PCHRD and the Department of Health through its AHEAD HSPR project. Okay, para po sa ating Q&A, alam na po natin, nag-announce po ang aking partner, si Dr. Susie. So, we will be joined by UP Assistant Vice President po ng head po ng Alumni Relations, AVP Rica Abad. AVP Rica, maraming salamat for filling in.
Yes, I'm always happy to serve.
Thank you, AVP Rica. Without further ado, we'll just dive right in. The first question po, we usually choose the most upvoted questions, and we have 3. We'll choose one coming in from Rory Visco, kasi may question din siya last week but we were unable to address that. The first question, and he's from the Health and Fitness section of the Business Mirror. What would be the basis to signal the go-ahead for the mass production of these antiviral medications? Will there come a time that they would eventually replace COVID vaccines so that it will be easier to store and transport, and so that they will be protected as well? Just address the first question. Dr. Edsel.
Yeah, thanks, Raymond. So it's being mass produced right now, and I think that the drug companies have actually been very good at licensing these drugs. Actually, Merck more than more than Pfizer, kasi mahal pa rin yung sa Pfizer. And these drugs can be ramped up in terms of production, but I do not think they come any close to the benefit that we get from vaccination, because yung vaccination talaga, yun talaga yung pinakamalaking kasi diba, there's been a lot said about breakthrough infection, especially with Omicron. But even with Omicron, the risk of getting infected from Omicron is still 5 times less compared to someone who is not vaccinated. So, nandiyan pa rin yan, even if it's lower than it used to be. But it's still there. But the most important effect of our vaccines is really preventing severe disease. And we're seeing more and more data that shows na the sequelae, the complications, and perhaps even long COVID are much less in people who are fully vaccinated.
I
Thank
think
you, Dr.
Doc Mary
Edsel.
Ann has her hand up. Doc
Yes,
Mary
go
Ann,
ahead.
nakamute po kayo, Doc.
Sorry. Yeah, thank you. I just wanted to add to Edsel's remark about mass production. We talked about affordability and access. The World Health Organization and other international partners are actually putting in their resources to what is called a medicines procurement pool, so that they make these agreements with pharmaceutical companies. The first one was with Merck, no? So that Merck would provide the license to produce the vaccines in developing, to produce molnupiravir in several developing countries like India, so to actually reduce the price. So that's one positive initiative. Except that we do know that molnupiravir does not have that great an efficacy profile. So we also look forward to the day that Pfizer will do the same and allow the medicines procurement pool to negotiate with them on the price of Paxlovid. And by the way, I put in the chat box the link to the Liverpool Drug Interactions app. Thank you,
Ayun.
over.
Thank
Yeah,
you,
thank you. Oo.
Mary.
Kasi Doc Raymond, parang usually ang naririnig ko, no, ang talagang barrier to the access ng medications is the cost. No, 'di ba nababalita pag may mga after nagkasakit, nagkaka-fundraisers pa usually, no, dahil pambayad sa ospital o kung may namatayan man, yung
Correct,
pamburol
correct
pa
po.
plus the hospital bills, ganyan. So, next question po, Doc Raymond.
Yes, the next question po, and I'll tweak it a little bit kasi this is not the only question with regards to this one. But the verbatim question from Rory was that many have already heard the statement from Octa's father Nick Austriaco about Omicron being the beginning of the end of COVID-19. But there are also questions, ano po ba, how does the end of COVID-19 look like? How do we begin to define it? Any comments on that, Dr. Edsel?
Yeah, first of all, it's not Omicron that is causing the end of this pandemic. It's the vaccination. I think we're giving too much credit to Omicron. Yes, it's milder than Delta, but Delta is worse than the original viruses dati. So, it kind of all comes out the same if you think about the original viruses. Remember, the highest mortalities that we saw were at the very start of the pandemic when we had no idea what we were doing. In a lot of countries, the mortality was up to 10% if they didn't lock down fast enough. And that's pretty much why we pushed for an early lockdown in the Philippines. If you compare a 10-day later lockdown in Mexico, and you look at their mortality rates compared to the Philippines na nag-open tayo sabay naman nung June, we saved about 200,000 lives just in terms of a 10-day delay. The reason is obviously because exponential ang increase in number of cases. So dati, that's the only thing we had. But now with the vaccines, hindi naman tayo MECQ or ECQ for Omicron eh. But what really protected us, even though we had 5 times the number of cases in some regions compared to what we had for Delta, hindi na overwhelming healthcare system, hindi na puno yung hospitals, yung number of severe and critical remain flat. So malaking bagay, more than Omicron being milder than Delta, the increased vaccination rate, particularly in NCR, is what is precipitating the end or the endemicity of this pandemic. So I'd rather focus on that rather than think that Omicron had really much to do with it.
Para sabi rin ni Doc Edsel kanina sa presentation niya that the medication and the vaccines together is essential to exiting the pandemic, no? So thank you po, Doc.
Okay, thank you, Dr. Edsel. AVP Rica also. Question coming in from Dr. Joseph Tortona. We'll post this to Dr. Lansang. Ma'am, any evidence po with regards to the treatment of long COVID and anything along those lines po?
The studies on long COVID are still ongoing. And the problem is the spectrum of long COVID is so varied. It's all specialties are involved, be it mental health, be it cardiac, be it pulmonary, etc. So that it's very difficult to really put them in just one mold and do a trial. So we still have to really look at the studies on long COVID in the future. There is some beginning evidence to show that the drugs, the antivirals, do have some effect on ameliorating the symptoms of long COVID. So we look forward to more data on that. Over, thank you.
Thank you, Doc Marianne. Doc Raymond, madami pa tayong tanong sa ating Q&A, even sa comments. So can we just request our doctors to please start answering na lang the questions sa ating Q&A box, and maybe respond to the questions in the comment box. So we can at least give our audience and our viewers the answers that they need for their questions. But I think, Doc Raymond, it's time for us to show how our audience has responded to our Mentimeter and Zoom poll kanina.
Okay, sige po. Can we have that on the screen? Okay, so we have two questions po, no? And this is something that we showed earlier before the start of our webinar proper. There are two questions coming in. So multiple choice po ito. Paano masasabing epektibo ang isang gamot? The options are nawawalan sintomas, option 2 gumiginhawang pakiramdam, option 3 hindi ikamamatay ang COVID, option 4 nabasa sa internet, and option 5 sabi ng kapitbahay. So multiple answers po sa question na ito. We'll ask Dr. Edsel to handle question 1 first po.
Naka-mute po yata si Doc Edsel.
So, you want me to answer this or do you want me to...
Yes po. Opo. It's not just one answer naman, Dr. Edsel, yes.
Right, yeah. Actually, as I defined it nga, I mean, when we say gamot kasi, it's anywhere from symptomatic treatment to actual. For me, the way I defined it's really an effect on mortality and morbidity. In which case, it's siguro the closest there is yung hindi ikamamatay ang COVID. Kasi nawawala sintomas ng pakiramdam, is really symptomatic relief. But I'm sure some people would object na hindi. Kasi di ba, we always, for doctors, the important is morbidity and mortality. But for the patient, it's their comfort. Pag hindi mo tinira yung kanyang chief complaint, malalagutan ka talaga. So in that sense, I kind of agree with what the audience is. But strictly speaking, it's really number 2.
Okay. Thank you so much, Dr. Edsel. For question number 2, we'll post this to Dr. Lansang. Alin sa mga sumusunod ang mga uri ng COVID-19 medications? Ma'am?
Okay, I think the box with the cluster with the highest answer, antiviral drugs, is definitely correct. But if you talk about COVID-19 medications in general, all of the above are actually COVID-19 medications.
Ayun.
But madaya itong Mentimeter, walang question na all of the above.
Yes. Hindi na po kami
But Dr. Salvaña, of course, provided the qualifications as to when you would use the other medicines like dexamethasone, anti-inflammatory therapy, etc. Over.
Thank you, Dr. Mary Ann. Maraming salamat po sa mga sumagot din po. We have more than 1,200 people who answered po our fun quiz. So maraming salamat po sa inyong lahat. We'll take on one more final question po before we wrap up dito po sa ating Q&A panel. This question will be posed po to Mayor Ofelia, yung pong nandito with regards to LGUs, ano po ba yung mga paghahanda with regards to following DOH guidelines, especially na nagkaroon na ng shortened isolation, facility-based quarantine, meron po ba, does the LGU have enough, that sort of thing, Mayor?
Thank you, Raymond, and thank you for that question. Tama, pinaghahandaan. And we follow the protocol na binibigay ng IOTF and then the Department of Health. So ngayon, we are allowing home quarantine for suspect cases or probable cases, and even isolation for positive cases. So like yung quarantine, sabi ko nga, marami kaming LSI. So ang protocol ngayon ay they will go quarantine, home quarantine, pero titingnan na hindi sila pwede mag-mix. Mayroong facility sa bahay na may CR, so all these things, no? Na pinapapuntahan namin yan ng aming health worker at saka yung aming MDR, RMO to check kung pwede mag-quarantine o mag-isolate sa bahay. So yan ang isang preparation. And then we follow. Kung vaccinated, 7 days. But we still do swabbing on the 5th day. Marami dito ang nagpapositive. So kaya hindi ko pa tinatanggal ito. We work with local INTS. So the others, may executive order ako na every month nag-change yan ang issue. And currently, naggawa din kami ng yung council. So I asked the council ng ordinance, especially ng height ng Omicron at saka yung marami nag-o-open na yung market, no, o yung pag-uuwian niya. So yes, we follow protocol, and then proseso we discuss with our local IATF and kung anong kailangan sa prevent, detect, isolate, and of course treat and reintegrate. Meron kaming localized. So we customize this policy at the local level. Mayroon din pala kaming enforcement, yung hindi, yung 2.5 per violation, part ng ordinances.
Okay. Okay.
Wow. Oo. So baka pasaway.
Good to hear, Mayor Ofel. Maraming salamat po that you're on top of this, especially in the Municipality of Tolosa, Leyte po, no? We're nearing the top of the hour, so for those who are, well, inclined po but really don't have that much time, the team has produced po this very very short clips that we call SCD shorts. So ito po, naputol po ang pantalon at naging short. Ito po ang aming listahan ng mga SCD digital shorts webinar po. These are just very very quick snippets coming in from the different webinars that we have had. This is webinar 87. Obviously, we've had 86 webinars. So marami pa pong pwedeng easily consumable po na content that you'll all be able to find in youtube.com po, in TVUP's YouTube channel. Before we ask our our esteemed panel with their final messages to the audience, we'd like to go on with our evaluation poll. Sana po gumana, AVP Rica.
Oo nga. Fingers crossed.
So, yun po. It's been a running joke for the past few weeks dahil po medyo it becomes wonky, but hopefully everyone will be able to come in. Hindi nyo po natatanong, this is our most viewed webinar for 2022. So, but this is a testament po to all of our panelists po and really the expert content that you're sharing to our audience po. The 5 questions for our evaluation panel, which is a 4-point Likert scale, are as follows. The panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. We will not be closing our evaluation poll. May pumindot, although we hope to be able to open it up back again. AVP Rica will be calling in our panelists po for their final messages.
Nausog yata, Doc Raymond. Okay, so now is the time for us to ask our esteemed panel for their parting words, no, for our viewers. Let us begin with Dr. Maria Ofelia Ocana-Alcantara. Doc Ofel?
Wow, maraming salamat, Madam. Beautiful. Yes, ang sa akin ay magtulungan at tayo sa especially na i-ensure yung buong municipality natin ay at saka lahat kasi kung bawat municipality sa buong bansa ay para masugpo na natin itong COVID, no. Still pabakuna and then practice minimum public standard and always coordinate with your or consult your health provider or your barangay at the barangay level at even sa household level for correct information. And thank you to all of you. Thank you, team staff COVID, and of course to my kay Edsel and my co-panelist na Dr. Lansing. Mabuhay po tayong lahat.
Okay, thank you very much, Doc Ofel. Now let's move on to the parting words of Dr. Mary Ann Lansing. Doc Mary Ann.
Thank you very much. Ay, umalis si Mayor Ofel. Mayor Ofel, sasabihin ko pa sana, thank you, Idol. So, yeah, and thank you, of course, Dr.
nag-globe up.
Edsel. My parting word is, well, I'd just like to have you take a look at the painting behind me. This is painted by a person who is deprived of liberty. That's what we call it, right? He painted this, people in a market with masks. And when I showed this to a good friend, Dr. Orville Solon, who was an economist, he said that the message is life goes on with COVID. As long as you practice proper minimum health standards and you have vaccines and the drugs available, we will do well for the future. I'm optimistic. Thank you very much.
Thank you very much, Dr. Mary Ann. And finally, let us hear the parting words from our main presenter, Dr. Edsel Maurice Salvaña. Doc Edsel.
Yeah, so thanks very much for inviting me. It's finally natuloy rin. It's a great pleasure to be on the same panel as Mayor Ofelia and of course one of my idol mentors, Dr. Ann Lansing. So I think that we are in a much better place compared to where we were 2 years ago, and I still remember those. Actually, I think lahat tayo nagpi-PTSD pag iniisip natin yun. Lalong-lalo na yung mga clinicians who really had to risk life and limb, literally. And every day you're thinking, when is this gonna end, di ba? So, malapit na tayo doon. Hopefully, last na talaga to. And I think that a big part of that is because of our vaccines and the fact that we have effective medications. So I look forward, hopefully, to see everyone in person na next time we have to do something like this. You know, I think everyone is sick and tired of this pandemic and would like to put it behind us. And so, you know, I tell people, I'll see you out there and stay safe.
Thank you very much, Doc Edsel. Doc Raymond, I think it's time to show naman our poll results, no?
Sige
So
po, sige po.
Mhm.
But we still are there are still responses coming in from our chat po, no, sa mga hindi po nakapag-participate. Pero maraming salamat pa rin po. It's really heartwarming to see how dedicated you are and really talagang avid readers po, viewers po ng ating webinar. Very consistent po with our previous webinars. More than 90% of all of our viewers selected strongly agree to all of the 5 questions po. So that really will be very helpful with regards to how we can improve our webinars in the future and the topics that we will be discussing beforehand. So for our closing remarks and synthesis will be introduced by AVP Rica.
Yes, it's our pleasure and always, taga inaabangan nito to give the synthesis and closing remarks. The Chancellor of the University of the Philippines, Manila, Dr. Carmencita Padilla.
Magandang hapon po sa inyong lahat. Today's webinar was opened by Director Raymond Sarmiento by stressing the importance of COVID-19 medications in selected situations. This episode puts in spotlight the importance of safety of these medications, the timing, the side effects, and the value of supervision of a physician in the prescribing practice of these medicines. Our main presenter is Dr. Edsel Salvaña, a member of the IATF Task Force. He started his talk by highlighting the following key points on medications. First, the objective is to decrease mortality and morbidity. Second, we must note that the highest mortality is in the vulnerable population. Third, vaccination has decreased mortality by 90%. He emphasized that medications are indicated for mild to moderate, high risk of progression, and severe disease. And fourth, we must remember that most people who are vaccinated and when with breakthrough infection, they will recover from COVID-19 without the need for medications. Now, Dr. Edsel showed the table on the step risk of dying, combining age and the vaccination status affecting outcome. And I I really encourage you to go back to the replay and take a look at that table, because it's so encouraging to see that just with the vaccination alone, you can actually go down to the minimum, as he said, just like an ordinary viral infection. Dr. Edsel discussed the medications with RCT evidence of an effect on mortality and morbidity. He just concentrated on the meds that will work on the viruses that are available in the Philippines in the interest of time. And he said there are 3 kinds of medications: the antivirals, the immunomodulators, and the monoclonal antibodies. But he gave detailed explanations on the first 2. And again, I encourage you to watch the replay, because you have to go back to the panel's recommendation for patients in the hospital and outside the hospital. He also showed the evidence on the reduction in the risk of dying with vaccination. So when you watch the replay, you've got to look at you have to review the actions, the dosage, the revised indications for the various antiviral medications. And I'm just going to mention one in the interest of time. For some time now, we were thinking that remdesivir was only for the severe type, but he did give this an example wherein it has been shown in studies that in mild to moderate risk patients, it showed 87% reduction of hospitalization or death compared to the placebo. It showed the same kind of data for Paxlovid as well as for the molnupiravir. He discussed dexamethasone, which was shown to decrease mortality among those on mechanical ventilation. And he actually cautioned us not to use it without any purpose, because it can decrease the resistance of a patient if the steroids are not needed. Now, he actually ends by talking about why medications matter. Well, first, the vulnerable population still have residual 1% risk of death even after vaccination. So that means all of us in the audience here, even if you've been vaccinated, even if you had COVID in the past, we can still have COVID. So hence the importance of understanding that medications can help, because medication can decrease the risk by nearly 90%. So you cannot do this on your own. You've got to get somebody to guide you. Second, he said that there is a need for more evidence among the vaccinated, but it's reasonable to assume that, that they help. The third, there is an emergence of resistance, and that, some decreased susceptibility with some of the mutations. And lastly, Dr. Edsel said that medications are very important, especially to those who cannot get vaccinated for medical reasons. Today, we have 2 reactors. Our first reactor is Professor Ann Lansing, an epidemiologist. I'm sure this is an excellent review for all of us in the audience. She started by explaining the difference between efficacy and effectiveness. Because in the title, we said, Epektibo ba? And she said, what are we referring to? Efficacy or effectiveness? So efficacy is one that's looking at evidence at the level of clinical trials. And in many episodes in the past, we've heard phase 1, 2, 3, and 4. And we all know that when you talk about a clinical trial, you're looking at a small set of patients on selected populations, usually multi-center, random controlled trials on very controlled situations. But she said that, we have to understand what is effectiveness. Because on the other hand, effectiveness would mean findings in the real world. This means providing the drugs in the right situation, but in a larger set of patients, not necessarily the same as the clinical trials. So Dr. Mary Ann asked us now, what is the point of an efficacious drug if it is not accessible or affordable? She reminded us that these drugs, all of the drugs that we have right now, are in emergency use authorization. There is still much to learn on the side effects and even on long COVID, and that we have very little data on vaccinated patients. Dr. Mary Ann said that even if we are in an EUA setup, there are judgment calls. So we have to understand that judgments have to be made, and even in short term, because we need to continue saving lives. She ended her message by saying, these drugs must be used under supervision of a licensed practitioner because of the many drug interactions. And she shared the app at the chat bags. And thank you very much, Dr. Mary Ann. Our second reactor is Mayor Ocana-Alcantara, who gave the LGU perspectives. She presented the opportunities and the challenges. The opportunities are the presence of protocols and policies at the LGU level. We all know that our community Tolosa is one of our models, thus showing that leadership at the local level is important for the control of our pandemic. The challenges still rest on the reduction of risk and severity, access to medicine, fake news, infodemics, and at the LGU level, she said that they have the added challenge of continued productivity and function for the asymptomatic and mild cases. But Mayor Ofelia, it's not only in the LGU level, I think all over the country. We've got to look at the functionality and the productivity of all the people with asymptomatic cases at this point. So she gave us a tip, the considerations on the grounds, access to information, access to medicine, the cost and budget. Although she said that she's got the budget for this, but it's a question of, to whom to give them. And the point of doing the monitoring, because after the drugs are given, what are the effects on the patients and what will be the role of the local government as far as improving the data on hand. She highlighted one thing that's, I think, very important at the LGU level, because she said that reaching the clients and the cases with the needs of partnership at all levels, not only at the level of the mayor, but at the level of the BHWs, the deployed nurses and midwives, the births and the RHUs, because without them, we will not be able to reach the clients and the cases. I think, for not only for the LGs, for all the communities in the country, it's so important to decide whom to give the medicine, just to the mild and the moderate or the asymptomatic, because at the end of the day, the supply is actually limited. So she gave the example when they ran out of oxygen, wherein even if they had the money, they couldn't buy it. And I think that's the value of deciding to whom to give the medicine, to make sure that the supply does not run out. Now, in closing, I was reviewing the messages, and then I'd like to highlight the persons and the street messages, because what is interesting is that they may not have known much about the medicine, but they knew the basic messages of home care. And I think that's very important for all of us. But in closing now, let me close with a summary slide of Dr. Edsel. And I think this is something we just have to remember at the end of this webinar. The medicines are safe and effective. There are safe and effective medications available for treatment of COVID-19. Second, the antivirals are indicated for mild and moderate disease in vulnerable population. Third, antivirals are indicated for severe disease. Fourth, we need more studies in vaccinated population. And lastly, the medicines and vaccines essential in exiting the pandemic, as these decrease mortality from COVID-19 to near that of the flu. In unison, all of our speakers agree that an ounce of prevention is worth a pound of cure. Kaya magpabakuna na tayong lahat. Back to you, Raymond and Enrica.
Hi, thank you very much, Chancey. Ang ganda-ganda talaga ng synthesis and closing remarks mo every time. That's why talaga, Chancey, madami nagko-comment talaga that they really wait for your synthesis and closing remarks. Okay, so we will continue the conversation on COVID-19 next week with another special topic on stealth Omicron BA.2, what every frontliner needs to know. Now, this one is going to be a virtual international conference. Part 5 na natin to, panlima na natin virtual international conference. So we will be having speakers from UK, from Singapore, and of course, from the Philippines, ang ating director ng Philippine Genome Center, si Dr. Cynthia Saloma. Doc Raymond?
Thank you so much, Chancellor Padilla. Excellent recap again and closing remarks for everyone. Sana po ay ito po ay tumatak sa ating lahat, especially marami na po tayong available na medications. Hindi po talaga siya iniinom ng wala pong supervision ng ating mga healthcare providers. So maraming salamat po for that final message. But before we conclude our program, let us first acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we will not be able to churn out our quality content week in and week out para po palaguin at palakihin ang ating incredible online community. And finally, all Stop COVID Deaths webinars po are archived for viewing at the TVUP YouTube channel. So if you go to www.youtube.com, type in po TVUPPH, you'll be able to see all 86 webinars. And then right after our webinar for today, 87 webinars na po siya to date. And we hope you'll be able to join us next week. Talagang international lang po ang ating flavor with regards to the stealth Omicron, yung ating BA.2 sublineage po na Omicron. We are sure that you'll be able to gain a lot of insights from our panel of experts. So this formally closes our webinar for this week. Magkita-kita po tayo ulit again next week, Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online!
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others love before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? Oh God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others loves before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, I will hold the line. I will hold the line.